Since the pandemic began, at least 3,200 Georgia nursing home residents have died from COVID.
3,207 to be exact, according to the most recent state data. But Fox 5 I-Team reporter Randy Travis has another disturbing number. How many Georgia nursing homes still don't have even 50% of their staff vaccinated?
The government says overall 7 people have died from COVID at the Bryan Center Health and Rehab in Canton. So when 94-year-old Hilda Dortch arrived last month after a fall in her home, she was determined to not be number 8.
It's the worst experience of my life.
She began documenting non-COVID concerns she saw with staff and management, like the food. Said she saw some staff without masks. Then she started asking workers if they'd been vaccinated like her. Only one said yes.
Would you have gone to that nursing home if you'd known 45% of the staff was vaccinated, the rest weren't?
Absolutely not. I would have gotten out immediately.
But where could she go? A Fox 5 I-Team analysis of the most recent Medicare and Medicaid records found 163 long-term care facilities across the state with staff vaccination under 50%. Bryan Center, where Hilda went, at the time she was there, 44.9%. Healthcare at College Park, 18.9% of the staff fully vaccinated. Julio Hills in Rome, 11.2%. In May, the Georgia Healthcare Association said their goal was 75% staff vaccination statewide. Right now, it sits at 50%.
What we're seeing in our nursing centers is very similar to what we see in the community in Georgia.
Healthcare at College Park did not respond to our questions. A spokesperson for Bryan Center says their staff vaccination rate is now 65%. And when it comes to mask violations, they remind workers why such infection control practices are imperative. Administrator Pam Williams from Julio Hills said they want more than 11% of their staff vaccinated, but because of other strict measures, the facility has had 0 COVID positive cases since January.
I would tell you today, being in a nursing home is probably one of the safest places you could be because of the high vaccination rates of residents.
Luckily, 3/4 are now protected by the vaccine. The main reason cited for only 83 positive cases and 20 deaths in Georgia nursing homes for the entire month of July. Back in January, it was 130 new cases, not every month, every day. But now there's the Delta variant, lurking in places where less than half the staff is protected.
Are those residents at risk?
Certainly they would be at greater risk than a center where they have 80% or 100% staff compliance.
And that's got a growing number of private facilities speaking the same word, mandate.
I think we're going to see more and more mandates because of the concern about people in positions like this who are exposed to very vulnerable individuals.
That's just what Northside Gwinnett Extended Care did here in Lawrenceville. Their staff vaccination rate is the second highest of all the records we analyzed, 99.2%. It's not 100% because there's still exemptions for medical or religious reasons. Last week, Pruitt Health, Community Health Services of Georgia, and AG Roads announced their workers must be vaccinated by October 1st. Pruitt alone employs 13,000 healthcare staff in 4 states. But just like a vaccine, a mandate only works when most of the people around you are doing it too.
If your company is requiring vaccination and there is a center that is located nearby that does not, that a large number of staff can simply shift and go to work for another center.
He says some have already seen staff losses of 20%. Bryan Center in Canton told us they'll make a decision on mandates soon.
I think it's terrible, uncaring, and in a way people are so uninformed. They don't want to accept science.
But it sounds like for some nursing homes, the choice is either have less staff or have more staff, but some of them not be vaccinated.
Well, that might be the case, but I say, do you want to choose life or death?
You don't have to be 94 to know the answer to that question. In Canton, Randy Travis, Fox 5 News.